Austin Herniated Disc Relief by Austin Chiropractor Dr. John D. Carlson. Herniated disc relief at home tips. Austin Herniated Disc Relief. Hello, I'm Dr. John Carlson, an Austin Chiropractor. If you're suffering with herniated disc, I'm sure relief is well on your mind. There are some things that you can do to help yourself at home, but herniated discs often need professional help to get them to be relieved, to get restored, be repaired. And early detection typically means early correction. If you have a herniated disc in your lower back, oftentimes it causes pain radiating down the leg or numbness into your leg. When the pain or numbness goes below your knee, 90% of the time that's due to a herniated disc. Patients also have lower back pain, or they have muscle spasms in their lower back, as well as cramps and muscle spasms into their leg. Now, patients who have herniated disc in their neck oftentimes suffer from pain in their neck and also into their upper mid back and radiating down into their hand or arm. Now, where the pain goes in your arm can tell the doctor a lot more about which disc or which nerves being involved. So, also numbness is another advanced symptom of a compressed nerve due to a herniated disc. Some things that you can do for yourself at home include using ice to your lower back or neck, depending upon the area of pain. I like to allow those gel packs to be placed upon your neck or your lower back, 15 minutes on, 45 minutes off, and make sure that there's something, a washcloth, a towel, or something between your skin and the ice pack so you won't get frostbitten. Also, after the acute initial pain, then you can use moist heat later on. Typically, moist heat does better than dry heat like you have with a heating pad. Moist heat by taking a hot shower or soaking in a hot tub can be excellent, and add the jacuzzi type of bubbling system with it makes the jets hitting on your back can give quite a bit of relief. Also, make sure you know what the positional preference of the disc is, whether it's in your neck or your lower back. In the cervical spine, patients who have disc protrusions, you probably already know that tilting your head back into extension is the position that you don't want to be in. So avoid being on the front row of the movie theater or looking up like you're painting or going to an air show or something where you'll have a prolonged period where you have to have your head tilted back into extension. And then if you're in the lumbar spine, make sure that you try to figure out if it's stooping forward, which is flexion, or bending backwards into extension. Either one of those can be a positional preference. If you feel better when you're bending forward, then you need to avoid extension, and vice versa. Now also, try to avoid long periods of sitting or standing or carrying things. Yes, be patient with yourself. Patients who suffer with herniated disc oftentimes are impatient because they got so many things to do and they need to get it done. They need to carry this, they need to lift that, they need to bend, they need to drive from here to Dallas, whatever it is. All of those are compressive activities. Typically put more pressure upon the disc, cause the liquid nucleus to go into the crack or the tear of the damaged disc and cause you more pain. Is for you to wear a lumbar support belt. There's those wide, oftentimes white and sometimes black, like you see people wearing at a warehouse or a grocery store, trying to prevent lower back injuries. Those elastic bands that will come around and tighten up, kind of stimulating an extra tension in your core muscles, and that can give you quite a bit of relief. However, herniated discs typically don't respond and heal by themselves. They get relief, but relief does not mean that the disc is healed. Now, early detection typically leads to early correction with herniated disc. Years ago, we used to think that herniated disc once injured, would die a slow spiral death and there's nothing that you could do. However, spinal decompression is the best chance of you working with your original GM parts to get restored, to get healed, and to get relief of your pain. So, if you want to know whether or not the chiropractic care can help you, I'd like to offer you a complete consultation, orthopedic, neurologic, chiropractic examination, to determine whether or not chiropractic care can help you, and if necessary and appropriate, a trial of spinal decompression in my office. Now, don't hesitate any longer. Call today. Call 512-447-DISC or 512-447-3472. You could also visit me on the web at www.carlsonchiro.com/blog. And if you'll just click in, enter your information, your contact information, I'll send you a lot more information about how chiropractic and spinal decompression can help you have herniated disc relief. Federal law prohibits providers from giving Medicare or Medicaid patients or federal employees anything of financial value. Therefore, this offer is excluded to Medicare and Medicaid patients and to federal employees. However, you are able to receive a free consultation at Carlson Chiropractic.